Hi, good morning, everybody. I want to wish everyone Merry Christmas and a happy, healthy New Year. First of all, I want to thank you very much for so many people from all over the world, including Hawaii, USA, Los Angeles. I saw quite a few people from Canada also, and throughout Asia, people are attending our webinar. So this is very, very nice to continue adding information regarding how to manage yourself from getting yourself into pre-diabetic or diabetes, and plus all the complication if you became a pre-diabetic diabetes that will come along the way. And today is a really, really important webinar. Why I want to say that is because of that I have quite a few patients who actually using the Lowsutea, so I got to know them. One of the lady, which is about 60 somewhat years old, she basically her blood sugar is around 10, the A1C is around 10%. So I help her drop her A1C all the way down to about 6.4, and she was very happy. She said, hey, my doctor telling me that I could lower medication. Then one of the things that I asked, I said, hey, this is really interesting because this is all by just talking and getting each other to know each other. I said, hey, 60 something years old, have you really, take a doctor to help you to do a colonoscopy, meaning a scope go inside your rectums, take a look at your lower bowel and upper bowel. I said, what is that? And I said, well, it's a common procedures when you get down to a certain age. You need to get that kind of examination to see whether you have potential, have polyps, and also cancer. Now, she is really not know of that risk at all, even though she is a diabetic, had no idea. So said, well, yeah, okay. So I encouraged her, and she actually listened and went there and did a colonoscopy. But unfortunately, with the colonoscopy, they found quite a bit of polyps. And one of the things they found, one of the polyps is cancer. And then certain doctor right away say, hey, look, you know what? Because you have that, you have to remove, that portion of the gut plus all the lymph node around it. So with that, she went to a surgery, and naturally she only stage 1 cancer. Because of that, there's no chemotherapy. It's just a surgical, with the wound. And as you know, nowadays the surgery is all by Da Vinci method. So it's just 5 holes, and she had about maybe a couple months of recovery. She's now perfect. Now, she is also very grateful. She said, hey, Andrew, you really helped me to save my life because of the fact that, gee, I'm diabetic now, and I will get another serious disease, cancer. I said, no, I just alert you. And I hope that you know that now, you got to really have several risks that you can potentially, you got to take care. And certainly, although this is a real story to help people to understand, as a diabetic, you have all kind of potential cancer. Now, diabetic is already a very serious disease, and there are all kind of problems that come along. And you don't want to get another more serious problem together down the road in cancer. Man, that is really something that you don't want to be in that boat. So the important for cancer is early detection, and then you can able to treat, and that the cancer did not spread to all the neighborhood tissue. That is the key. And guess what? Because of the alertness, I just informed her to do that. She said, wow, that would be good. I'm able to do that. If we do not alert her, she will never associate the diabetic and the cancer relationship. And that's why I think that is something that I felt very good that we have this lecture created to get all our pre-diabetic and diabetic patients, and also people who not really familiar with it, can able to have awareness that you can able to understand what is the risk. And I want to make sure that you guys have that clearance, and then you can able to start acting. The key is act. Lucky my patient that she is really had the courage to act and did not delay. Because if you delay, you know what can happen? Anytime this cancer is opportunistic cells, they will go around and go spread in the lymph node, then you are big trouble, right? So really, we don't want to do that. And now she's very happy. There's no chemotherapy. Everything's good. All she got to do is just continue to check, make sure all the polyps don't change to cancer because all the polyps are removed too. So as you know, colon cancer is a silent disease. You don't feel pain. You don't feel anything. Matter of fact, in the early stage, you don't even have blood coming out from the rectum or anything like that. So really, the key is early detection. OK， 各位朋友，我係 Angela Lowsutea person， 你好，哇，好高興啊！今日咧又同你傾到偈喎。點解咧？今日有好多人喺美國啦、加拿大啦、東南亞國家、香港啦，哇，就好開心聽你。咁其實點解今日要有呢個節目講俾你聽咧？咁其實我哋有一個病人咧，咁其實我都幫助佢個由 A1C 10咧跌到6.幾以下噶啦。咁但係佢咧就60幾歲，咁我就喂，你有冇睇過即係腸鏡㗎？咁咩嚟㗎？嗱，個原因佢真係冇 association， 即係冇 idea 點解要做腸鏡。我話你咁嘅年紀，你有糖尿病，咁腸咧係有一個高嘅機會咧係有腸癌嘅。咁佢話點解要做咩嘢好啊？咁我就介紹咗佢即係要做個照腸嘅醫生去做呢個照腸啦。咁照咗腸之後咧，佢即刻就知道原來佢裏邊咧已經好多一啲咁嘅息肉，再加埋咧係有一息肉係有 cancer 嘅。咁佢個醫生話：喂，你要即刻要割症喎，因為如果唔割咧，呢個 cancer 會 spread 去第二度咧，咁就好弊㗎啦。咁佢就好聽話，即刻去割。割咗之後咧，佢依家嘅手術咧好簡單，唔係開肚嘅，得5個窿嘅啫。咁佢2個月都搞掂晒，即係全部 fully recover， 冇晒問題嘅。咁但係個問題咧，重要點咧就係佢因為佢去即刻去 act， 即刻去做咗之後咧，咁就變咗係一個好好嘅動作咧，將個 cancer 咧係 stage 1係全部切除。咁切除咗之後咧，佢冇任何要做化療啊、電啊或者任何嘅地方，佢只係繼續 monitor 啫。咁同埋所有息肉都切除咗咧，咁機會俾其他嘅息肉去轉 cancer 咧，就已經係冇咗喺度啦。咁所以咧，佢係十分一個好嘅，我覺得 example 啦，佢肯聽話去做嘢啦。咁今日點解做呢個講座咧？原來好多人都唔知道，哇！原來糖尿病仲有一個地方咧可以 associate 到 cancer 嘅喎。嗱，呢個更加危險。點解咧？糖尿病已經危險啦，再加一樣更加危險，你唔做嘅時候，啲降散咗咧，哇！你好慘啦，因為你有好多不同嘅地方又要化療成咧，咁就好 complicated。所以今日咧我講咗，等你了解咗就知道有咩要做咧，係幫助到你咧，係能夠令到你咧唔會有其他嘅即係風險啦。咁好重要咧，就知道最緊要 act fast， 要做即刻去做就唔好令到你啲 cancer 去散播，同埋知道咧糖尿病同 cancer 有咩嘅聯繫咧。咁呢個咧係今日我哋嘅講座。So I'm so happy to see many people like Pat and Eugene and hey, by the way, Eugene, can you give me a 1 if you can hear me clearly, so that way I know you are okay. So I'm going to start my webinar now, and so hope that you guys going to able to see my screen, do well, and so that will be good. Thank you. Okay, today our webinar is going to be a really good webinar for everybody, because what happened is now you have something to understand. What is the link between diabetes and cancer? Now, a lot of people really have no association, because I had talked to many people, and they really felt that, hey, what is that relationship? And so now when I start talking to this, then they start, oh, wow, you mean is this really have that many, that many issues that might be potentially relate to me? So I thought that this is going to be an important webinar for everybody. That's why I created this webinar. Okay. 各位同學，今日我點解作呢個lecture 咧？因為好多人咧都睇唔到呢個佢哋癌症嘅關係啦，同埋糖尿病嘅關係。咁當如果講咗之後咧，咁你就知道哇，原來有好大嘅關係嘅喎。咁變咗嚟講咧，最低限度咧，我哋可以啲人可以了解到咧，就哇原來真係要注重嘅，因為最重要癌症咧就係早發現。同埋仲有咧係唔止早發現，要早即刻 treat， 即刻去割咗啲癌症走，咁你咧就變咗即係長壽又身體健康。OK， So today we're going to talk about, understand the link between diabetic and cancer. So first of all, what we'll talk about is introduce what is the prevalence, what is cancer, what is diabetic, and then we'll talk about in depth about what's the risk factor and what cancer impact the glucose metabolism. That's important because with that you understand, when your cancer is really affect your insulin, your body usage, everything. And when you have diabetic and cancer, how do you manage it? And how Lowsutea can help you, and then we have question and conclusion, and that is today's webinar. 嗱，各位同學今日咧個介紹咧就係第一，知道咧乜嘢叫做cancer 啦，癌症係乜嘅啦，咩叫糖尿病啦，佢同埋點解佢會有一個聯繫咧？有個風險，有咩風險咧？癌症同埋同埋嘅糖用途有咩影響咧？癌症者，當你有癌症嘅時候，同埋有糖尿病嘅時候，咁你點管理咧？好 complicated 啦，因有呢樣嘢之後，咁同埋去量齊有乜能夠幫助你咧？咁我哋今日咧就有討呢個結論啦，同埋咧仲有咩任何答案嘅。Now I saw a lot of really people that I don't seeing them in the chat group. I mean the attending group. They're mainly probably from other places like Canada, Australia, New Zealand, or USA. And so what I would do is I'm going to give me about 5 minutes to catch up, our previous discussion. They can really understand that. Everybody will go through 4 stages of diabetic. The first stage is the LDL cholesterol goes up. Now, when the LDL cholesterol goes up, it will damage the B cell. The B cells will take the sugar into the cell. So B cell doesn't work much anymore. More sugar goes up. Now that is a major issue start going because the cholesterol and the sugar get together, the blood becomes thick. And you quickly move to stage 2 where it will start plugging everywhere. The plaques is going to form on your vessels, and then you're going to form plaque on your brain, your heart, and everywhere, extremity. So then after that, you're going to have your blood pressure goes up because the vessels are all plaques. So the vessel becomes smaller, blood pressure goes up. Then you're going to move to stage 3 because your sugar continue goes up. Now, every doctor will measure you where you are at. Are you a pre-diabetic or diabetes? By one method is called HbA1c. If your hemoglobin is a red blood cells, that they will measure the percentage of sugar attached to the cell. This is a 3-month average. And then if you are like 5.7 below, you're a normal person. If you're 5.7 to 6.4, you are pre-diabetic. If you're over 6.4, you are diabetes. Now, if you don't do anything, doesn't change your lifestyle, like weight control, diet, and exercise, you know what? You are going to be really very quickly moved to your diabetes stage. So during this pre-diabetic stage, one thing that you can help yourself is drinking Lowsutea. You continue to lower because there are no drugs. They're just this tea will continue to help you to lower blood sugar, cholesterol, and blood pressure. And it's about 1, 2 weeks, 3 weeks, you're going to start some effect and it will continue moving downward. But once you got a 6.4, you're diabetic now. Well, you still, when you're diabetes, you still continue to make sure that you can do your diet control, exercise, and weight control, and bring the sugar back plus drinking Lowsutea. You might get down to 6.4 before. But once you record your diabetes, you're ever diabetic. You will not change that record. So that is the problem. We don't want you to be in that stage. I want you to make sure that even though you are diabetic or pre-diabetic, you stay in pre-diabetic and lower, okay? Now, why drink Lowsutea? Well, Lowsutea has 2 things in there. Only thing is guava leaves, which block the sugar going to the large gut vessels. And bitter melon, it has a very magical effect. It increases the sensitivity of the insulin, so take back the sugar into the cells. The excess sugar will dump out through urine, cholesterol dumped out, and salt dumped out to the urine. And when salt comes down, blood pressure comes down. So it's a really effective decrease of 3 high. So it's a wonderful, and even you take drugs, it doesn't have no caffeine, it doesn't affect the sleep, doesn't affect the medication. So continue to do this. Now, we really do not just want to tell you to, drink Lowsutea. We want you to also to follow 5 programs. The 5 program is 1, we have a diet program, which help you to basically better understand, what to eat, how to help you to lower your low carb diet, low fat diet. We also exercise program. You walk 10,000 steps a day. We have rate control, help you move your BMI from 30 to maybe 23. And then we have weekly webinar. It's all free. And then I will give you a link. Maybe hopefully that we can you can always copy the link and listen to the previous webinar, and that will be really good. And also we have you can also teach how to daily track your blood sugar. Now, unfortunately, if you do not, for example, if you do not measure your blood sugar, you will never know where you are at, because when you are high blood sugar, you might not have any kind of symptom. Low blood sugar is the same, except you're very, very low or very, very high. So you got to really know how to measure your blood sugar and track all the time. And that's something we'll teach you. 嗱，各位朋友，因為今日我見到好多人咧係都唔係我熟嘅，因為見到啲名咧都係唔似我認識。唔緊要，我哋 take 5分鐘咧就即係增加佢哋catch up。第一，糖尿病個個咧都 go through 4個 stage 嘅。第一個 stage 咧係 type 2 diabetes 咧就高呢個 LDL cholesterol 上嚟啦。咁佢咧就 damage 嗰啲 B cell 啦 ，B cell damage 咗之後咧，咁嗰啲糖咧就帶唔翻入去細胞裏邊喎。咁糖加埋呢個高膽固醇咧，咁啊弊啦，嗰啲血糖咧就會一路係咁高啦。咁佢就變咗咧就會啲血變咁好結，好結咧好快 move to second stage。啲血結咧就全身係咁樣塞咗之後咧弊啦，咁你就喺度血壓會上升啦。咁然後好快脆咧就去第3個 stage 係點啊？第3個 stage 咧就係你會有好多呢啲咁嘅血糖上升咧，個醫生就會度你呢個血糖咧係咩叫做你係咪依家前期患病啊？又係真係糖尿病啦，咁佢會 measure 一個嘅 HbA1c。嗱 HbA1c 咧，佢度如果你5.7以下咧就係普通人，5.7以上至到6.4咧你係糖尿患病者。如果繼續落去咧，你一路唔理啦，乜嘢都唔做咧，咁你好快脆3年後咧就變糖尿病。咁至於個係前期患病嘅時候，或者去糖尿病咧，都有一樣嘢可以幫到你嘅，就係叫做飲去糖茶。嗱，去糖茶咧唔會 affect 你嗰個食藥啊乜都唔會嘅，佢就只係幫助你降低血糖、膽固醇同埋血壓嘅啫。咁但係去到 stage 4咧，你轉即係如果你咩唔做咧，你就好快去轉糖尿病嘅時候咧，咁你繼續落去嘅時候咧，你都係要處理點樣降低你血糖去翻6.4以下嘅。所以呢個咧係一個一世嘅病，醫生係一定要靠你自己同埋食藥去處理嘅。咁點解去糖茶要重要啊？因為去糖茶咧2樣嘢，有呢個番石榴呢邊咧就 block 咗啲糖入去個細胞血管裏邊啦。個苦瓜咧係帶翻係呢個 increase 咗個胰島素嘅敏感度，所以帶翻啲糖入去個細胞裏邊喎。咁如果 excess 嘅糖點啊多糖咧，佢就將去睇尿啊就出嚟，同埋佢嘅呢個 cholesterol 亦都喺個尿嗰度掉咗出嚟，咁同埋佢掉埋啲鹽出嚟，掉埋啲鹽出嚟，膽固醇掉晒出嚟咧，咁你血壓咧就開始降低嘅。咁其實咧呢個係一個十分好嘅產品啦，就冇任何嘅咖啡因又都唔會同你藥會撞嘅。咁其實我哋唔係隻咖飲茶嘅，我哋要你希望咧有教你食嘢啦，用咩叫低碳水化合物食物去食啊，同埋有咩叫做低脂肪食物啊，每日行8000步啊，同埋有 BMI 控制到20，即係去到23啊，同埋咧要學下點每日呢個每個禮拜都有咁樣講座咧，等你了解多啲點能夠去管理嘅糖尿病。咁就每日要度糖點做啦。咁所以我希望咧，我哋所有病人，就算佢 A1C 高過10咧，我都可以降低佢6.4以下噶啦。好多都只有5.7嘅。So now we talk about, wow, what is diabetic and cancer? Because this is a really topic that we have not touched on, but I thought this is so important because now I saw quite a few of our patients start seeing, wow, that is something that I totally cannot associate, did not associate, okay? So we will first talk about what's diabetic. As you know, everybody now, if they have diabetes, they have not sufficient insulin, or even they have insulin, they cannot use the insulin effectively. So the blood sugar become not really good, always very high or very low, and it can cause all kind of health complications. Later on, we'll talk about a little bit what is health complication come in. Now, the cancer is even more complicated, and that's why you really do not want to get yourself into there to get a match up to have this kind of complex disease, because it will make it so hard to manage. The self growth will be basically get a lot of growth from your from the cancer, which take away your the cancer cell actually took away a lot of the sugar, because that food take away from you, and it is really who support their cancer growth. And that's something that's really sad. And that's why it's so important that when you're cancer, how to what will be your body be affected, and also at the same time the type of cancer, the risk factor is higher than the other. That's the reason why you got to treat as soon as you can, and then make sure that you eradicate the cancer and don't let them spread. Because if you let them spread, you're going to have all kinds of issues, and you don't want to be in that boat. So cancer have many different cancers. So it really affects you a different way. So you got to understand what is the higher risk of cancer, what type of high risk of cancer if you're diabetes. And we will talk about that later. Now, certainly if you are a diabetes, you're going to have all kinds of complications, because you're going to have risk of complication of stroke, loss of memory, cataract, glaucoma. You will have pancreas malfunction, so insulin not enough. The worse that you're high risk of heart disease, high blood pressure, damage of vessel, nerve damage is extremely high. Practically a lot of people have that, and people cannot feel injured. Leg become so bad that we have to amputate. And then you have kidney disease, and you have dialysis. Pregnancy complication, that's bad. And then majority, because of that, no feel from nerve damage, then you have sexual dysfunction. So these are the kind of complications which I talk about. 嗱，各位朋友，其實我想俾大家了解到咧，咩叫糖尿病咧？其實糖尿病咧就係你胰島素出咗嚟唔夠胰島素，呢個第一樣嘢。第二樣你出好胰島素，但係用唔到嘅，因為你 B cell 係 damage 嘅。咁呢個咧就呢個叫 insulin resistance 就好高嘅。咁呢個咧就係導致你咧就係啲糖喺個血管係繼續咁上升。咁呢個癌症咧，嗱呢個有一個好大問題啦，因為癌症咧其實好多種癌症嘅。咁你真係唔想你喺你呢個癌症裏邊咧繼續喺度發生。點解咁講咧？因為當你癌症咧係有不同嘅癌症發生嘅時候咧，你有好多嘅大家嘅不同嘅 risk 嘅，你個風險咧越整越大。因為不同癌症有不同嘅風險，咁同埋最重要咧，癌症係早啲知道，即刻係可能夠控制割除，咁變咗唔會 spread 第二笪地方。所以呢個咧係今日我所講嘅東西咧係一定你早啲知道，咁就防禦到咧佢擴散。呢個係我今日希望做一個俾你有一個呢個嘅 alertness 有個呢個了解，咁你就能夠蘇死一樣嘢。咁其實點解糖尿病咁大問題咧？你好多風險嘅。第一，你會唔記得嘢啦。最大問題，依家好多人已經係會有呢個嘅 Alzheimer disease 啦，亦都有 cataract 啦、眼矇啦，個胰臟係唔 work 啦。咁同埋咧，最大問題依家係好多糖尿病有心臟病啦、血壓高啦、嗰啲血管硬化啦、神經系統損壞啦。啲整親嘅腳咧唔好，你割咗個腳啦，腎病咧洗腎啦，同埋好似懷孕咧亦都有呢個問題啦。第時懷孕前，依家懷孕後啦，變到糖尿病啦，同埋喺性功能冇咗，因為你冇感覺。呢啲係全部我哋所知嘅多數嘅即係後患症啦。So in global statistic in 2021. Now they said they have about 536 million people are diabetic. Wow, that's a lot of people, by the way. And then in the 2045, even more, there's 783 million people worldwide will be diabetic. Imagine that. lots and lots of people in diabetes. In the United States, there's about 130 million people are pre-diabetic diabetes. So there's a lot of people. And then there in 2020, estimated is 19.3 million new cancer cases. And then 10 million people are died of cancer in 2020. So a lot of people, millions of people die of cancer. So it is something that you guys need to remember and worry, okay? So that's the reason why I got you some of the figures. 嗱，全世界現在有536個 million 嘅人咧係有二型糖尿病嘅。2021呢個就係、原來喺2045咧仲更加勁，有estimate 有783個 million 嘅人。咁然後喺癌症上咧，2023年咧有19.3個 million 嘅人咧係有呢個 cancer。死亡率咧有10個 million， 哇，好多2020。咁所以咧，其實咧兩樣嘢都係一個好唔正仔嘅data， 能夠令到你咧，其實我哋真係要注重咩嘢叫做糖尿病，咩嘢叫做癌症，呢個係好重要嘅。咁 so we are now will share with you what is the risk factor of both diabetic and cancer. So let's talk about, first of all, as you know, when you have cancer and also diabetes, a lot of time is go with genetic. For example, in genetic cancer, if you're generic, you could have someone that who is suspected, you can have both cancer and also diabetes, okay? Usually this comes from family history. In other words, your parents or your family or grandparent has diabetic, and your risk to get cancer and diabetes is high, okay? So this is something that you know. Now, for example, how associate that? If your dad, mom is diabetic, the chances you get diabetes is high. Now, if one of your parents also can have cancer, the chances you have cancer is already high. Now, also, you're going to associate if your parents or your grandfather or whoever have gut cancer, you know, any kind of colon, rectal cancer, the chances of any gut cancer you will have are also high because this is all genetic, okay? So these are the kind of example you need to think about. So find out from your parents or your relative, do they have cancer, or they're diabetic, but do they have cancer? Now, also another thing, if you're young, most likely you might not have the cancer, but your age factor, you know, where you're 50 or 60 years old, I have risk of develop type 2 diabetic, plus you have a risk to develop cancer. Now, cancer is more common in men than women, and men have higher risk of develop diabetes. So this is a common genetic factor which you need to pay attention. Now, another thing is environmental. Now, environmental is toxin, chemical that lead to diabetic cancer. Like, for example, if you work in a shipyard, you always breathe in really a lot of chemical from the ship. Now, the chances of you getting cancer is high. Plus, if you're diabetic, even higher. And so that's why you need to think about, you know, when you work on the environment. Plus, the environment, besides the environment, also lifestyle. If you are really a person who have tremendous, great lifestyle that I like to eat and drink. I drink 6 beers a day, so I don't do much of physical activities. The chances you have for diabetes is high. On top of that, your cancer is high because you're obese, you know, active. Man, that will be giving you a big chance of cancer, okay? So another thing, lifestyle can be another issue. So in other words, I'm not an active person. I don't move much. I ain't active. I don't exercise. And on top of that, I eat habit is really not so good because I like a big steak every day, man, with good steak, okay? And then I like to eat my dessert, 3 ice cream a day with Sunday, you know, chocolate ice cream. Man, that's going to be really setting you up for diabetes. Plus, because your diet is so poor, you're obese. So usually that will also increase your risk to get all kind of cancer for you because your diet are not well controlled. You don't work, you don't exercise. Oh, wow, that will be a big problem, potentially develop diabetes and cancer. Another one is smoking and drinking. So you are also big, you also smoke and drink, and then the risk factor of diabetic is high, and also develop cancer is also high. So, but if you drink just one glass of red wine a day, might not be an issue. But if you drink continuously with high whiskey and all that, the chances is also high. So really, at the end of the day, there are three major factors you need to always think about: generic, you have to think about environmental, and also really at the end of the day, your lifestyle. So 各位嗱，因為咧 cancer 咧同埋糖尿病咧，好多時咧係好associate咧你嘅遺傳嘅。如果你爹哋媽咪或者你爺爺嫲嫲係有cancer 嘅，咁佢同埋咧亦都有糖尿病嘅，咁你 chance of you 咧你有 cancer 咧係高嘅喎。咁呢個咧你就真係要注意啊 ，OK？ 咁仲有啦，個家族裏邊咧同埋多數咧係男性咧係 cancer 咧係高啲嘅，女性咧係少低啲嘅。咁男性咗咧或糖尿病咧亦都高啲嘅。咁就環境上嘅問題啦。嗱，如果環境上咧有個 issue 咧，就好似我喺個船務公司裏邊做嘢嘅，我上船好多 time 嘅。嗱，船裏邊有好多不同嘅 chemical 咧，係咁聞咧，尤其是遊船啊，有 oil tanker， 咁你咧就會係增加癌症機會係高好多嘅。咁就係飲食習慣啊、住嘅環境啊，你係好中意食好多肥嘅嘢啊，咁呢個亦都係一個 issue 嘅。咁就係生活方式啦。嗱，因為你係唔喐嘅，你係唔中意運動嘅，我日日都要食 steak 嘅，要食鋸牛扒嘅，咁好肥胖嘅。咁呢啲咧全部係一個唔正當嘅東西咧，俾你嘅身體咧影質不健康，俾你有糖尿病同埋癌症嘅。咁仲有啦，我又要有6杯啤酒嘅，同埋咧我啲係有食緊煙嘅。咁兩方面咧，呢啲都係俾你能夠有癌症嘅風險同埋糖尿病風險啦。咁同埋女性咧飲一杯咧就反而冇問題喎。但係如果你日日都係飲唔淨一杯啤酒，唔係一杯紅酒，我飲5、6杯嘅，同埋咧亦都要又要飲幾杯啤酒嘅，咁呢個亦都好大問題。我有一個我哋自己嘅，即係我哋嘅堂友啦，咁佢咧好怪咧，晚黑咧11點鐘咧，嗰啲血糖好高嘅。點解我問下？因為話原來點解你血糖唔會高咧？佢每晚都飲紅酒，去到即係佢飲半支紅酒，所以晚嘅血糖咧係彈上咁上嘅。所以其實咧即係解紅酒之後，個血糖低翻晒啊！所以千祈唔好諗住哇好正啊，慢慢去 relax 晒自己飲呢樣嘢，唔正仔。So we talk about just now quite a few important things we talk about. Well, first of all, is that genetic factor? Yes, there's genetic factor. The secondly, we talk about the environmental factor. Yes, there's big environmental factor. If you were a shipyard, for example. And then third is your lifestyle. If you are not controlling lifestyle, you only eat and don't activity, that will be a major problem. So we talk about what is a common pathway to lead you to associate with cancer and also diabetes. 咁我而家就講下咧，點解會有 cancer 同糖尿病有咩嘅大家喺度連接到你咧？ So the common biological pathway is that first, a lot of time every diabetic, they will have all associated with this as insulin resistant. Insulin resistant is a common thing for diabetic. What does it mean is when the insulin comes out, but the cholesterol keep damage the B cell, the B cell keep coming out, it doesn't work, it doesn't take the sugar into the cell, so your insulin consider what they call insulin resistant. Then you will higher risk to develop cancer because when you have a lot of insulin come out, insulin is a growth factor which encourage cancer cell. In other words, the insulin, because you keep coming a lot of insulin, it helps the cancer grow. So even though you have a little cancer, you can be wiped out by own immunity, but you give them more chance to grow, then you have a more chance to get cancer. So that is one item. Second is inflammation. Now, as you know, if you are diabetic, all the vessels, everything are really inflamed because you always have a lot of sugars around. So the vessels will continue to be inflamed, accommodating this additional sugar. So the inflammation can really give the cancer a great environment to grow because you are inflamed, making more of them easy to go, and then will contribute the progression of your tumor. So really, continued inflammation is never good for you, never able to help you to control cancer, which encourage them to grow. Now, third is hormonal imbalance. When you're high level of insulin, high level of estrogen or androgen, due to the hormonal imbalance, it makes cancer also very easy to grow in people who are diabetic. So all these three factors can actually encourage cancer. Cancer is really an opportunistic cell. If there's way they can grow, is really with insulin resistance, your body inflamed, hormonal imbalance, all these things is actually encouraging, giving a chance for them to grow. 嗱，各位堂友，其實咧，當你胰島素抗拒，因為你胰島素咧出咗嚟，嗰啲 B cell 計俾人 damage， 咁佢咧就會令到咧嗰啲越多 insulin 出嚟喎，但係個 insulin 有個問題咧，胰島素係有一個 IGF 嘅，喺呢個胰島素增長嘅，令到嗰啲癌症咧俾到機會佢咧係個細胞增長快啲，因為佢能夠有個 growth factor 喺裏邊啊，咁呢個咪好弊啦。咁同埋仲有啦，如果你係全部成日都有糖尿病嘅，咁你全部啲血管咧就會有 inflammation， 好似發炎一樣啊，佢好多糖走出嚟啦，咁啲血管咧就準備晒，佢係好似發炎一樣發脹咗咁樣。咁呢個發炎咧有一個問題出現啦，因為你長期發炎咧，令到嗰個癌症咧就更加好嘅機會增長啦。咁呢個情況下咧，亦都係令到好多癌症不同嘅癌症咧係有一個快啲嘅進展嘅。仲有荷爾蒙啦，因為你好多時咧，你胰島素好多出嚟嘅時候咧，令到好多荷爾蒙estrogen androgen 嗰啲不同荷爾蒙咧增加好多嘅。咁呢亦都係令到咧癌症咧係好好嘅增長。咁所以咧胰島素抗拒、長期發炎同埋荷爾蒙失調咧，係令到你個 cancer 係好好生長嘅。所以咧要做到唔會俾你癌症嘅好嘅機會做上。So more importantly, you really gotta make sure that you don't give your cancer a way to grow in your body. Okay. So really, at the end of the day, now we have to talk about a little deeply. What is the really type of cancer associated with the diabetes? Now, this is an important one. This few slides is really important. You need to think about. Okay, I'll tell you just now. Tell a story. One of my patients is called colorectal cancer, which really she had no idea. Now, one of the cancer in type 2 diabetic have a high risk getting colorectal cancer. This is because high blood sugar all the time in the gut area and a long time insulin resistant. Colorectal cancer is actually a highly easy develop because you have always sugar in the gut with all the vessels, high sugar levels. Okay. Secondly is pancreatic cancer. So the pancreas that continue to get, you got to keep doing a lot of, insulin coming out and over the pancreas. So people who have pancreatic cancer are double in diabetic patient. And plus, liver cancer is also a high, cancer association. And usually, this is also play an important thing is genetic role. In other words, if your dad or your grandparents have liver cancer or pancreatic cancer, the chances you have are higher. So you got to check. You know, to tell a doctor that, hey, my relative had high colon cancer or rectal cancer or liver cancer or pancreatic cancer. So you got to really tell your doctor to check for you. Now, breast cancer for women is also high with diabetic because these are type 2 are more likely to get breast cancer, and outcome can be worse because a lot of time you don't feel anything. That's why once you get diabetic, if you are 30 or 40 years old, you got to continue monthly measure on your breast to feel you have any lump. Small lump, get to do the doctor, check it out. Make sure that there is no lump because When insulin resistance goes up, inflation go up, is also encourage breast cancer for women. So these are the three things. Colorectal cancer, I already gave you an example earlier. You know, one of my patients who have colorectal because she was by colonoscopy found out that cancer right away eradicate. No more cancer, then no chemotherapy or anything. She feels very healthy. So the key is early detection. So pancreatic cancer, breast cancer are common for diabetic. Now，所以各位堂友，直腸癌或者大腸癌咧係 common 嘅，所以記住咧，一定如果有呢樣嘢咧，即刻咧就去揾醫生 check 睇個 scope 裏邊睇有冇 cancer。咁第二啊，胰臟嘅胰腺 cancer 咧好 common 嘅，嗱呢個亦都有好多係遺傳啦，亦都係 associate 會你有 liver cancer 啊，嗰呢啲咧都係好有係1倍嘅，因為如果你有大髀你1倍嘅人咧，都係有呢個胰島素嘅 cancer 嘅。乳癌亦都係一個好 common 嘅 lady， 尤其是40零歲戶，咁你每個月咧都會自己 check 要撳，睇下你有冇一個lump 個 cancer， 呢個係重要嘅。所以一有lump咧就即刻要揾婦科醫生睇睇呢個lump係乜嘢嚟嘅，係咪一個potential 癌？呢個癌咧佢就要做個 biopsy 去 identify 嘅。So another one that can be a potential cancer is bladder cancer. Now, bladder cancer is 1.2 to 1.5 range, and it could relate to chronic inflammation, exposure to harmful substance in the urine. So bladder cancer is common. Now, bladder cancer is also, unfortunately, a lot of time has no sign symptom, except eventually get blood urination, and then you really got to check. So really at the end of the day, so you got to check your urine all the time. Check, is it really sometimes bloody urine or painful urination? These are things that you have to continue to check as you get older, especially when you get down 60, 70 years old. Endometrial cancer, the risk of for women, especially the urine cancer is 1.5 higher in women. Diabetic potential linked to chronic because the high insulin level and obesity. So you're obese, you really need to look at endometrial cancer. Now, liver cancer is high, and basically 2 to 3 times more people who have developed liver cancer in type 2 diabetic. And the real more important because you constantly get chronic inflation in the whole body, plus potentially get the liver also although inflamed, plus insulin resistance and obesity. So liver cancer are high, so you really, if you're obese, you need to think about how about liver cancer will be an issue. 嗱，有個好多唔知道咧，原來好多人咧有膀胱癌嘅。膀胱癌嘅時候咧，好多時候冇症狀，亦都忽然間你就有小便有血啦，咁就即刻要睇醫生啦。因為小便有血咧係同埋咧有痛啊或者 whatever。如果你冇痛冇症咧，就有血咧，你都要睇醫生，因為點解？呢個係可能有真係膀胱癌嘅。嗱，子宮頭內膜嘅癌咧亦都係高嘅1.5倍嘅。咁仲有咧就係最重要肝癌啦。嗱，肝癌咧其實亦都係冇乜症狀嘅。一般人有2至3倍有呢個 potential。如果你係2型2型嘅糖尿病咧，你2至3倍多過普通人2至3倍有呢個肝癌嘅。所以呢啲咧全部咧係你幾樣嘢咧，呢啲癌症咧係好 common 咧喺2型糖尿病裏邊嘅。So we'll talk about all the 3 different type of cancer that potentially more higher risk for type 2 diabetes. Now we'll talk about glucose. We'll talk about when you have cancer, why your glucose will be all whacked up. Why your cancer will affect all your glucose metabolism. You remember, cancer is an opportunistic disease that a cancer cell will love your food that intake you, that you have intake, because he's want to really grow himself. So whatever food you take, they're going to take it out, and they require a large amount of glucose for grow and lead them to lead the cancer going to grow high, and you will have leading a hyperglycemic and also could be insulin resistant and other tissue, because cancer really take a lot of sugar. That's the reason why many of the cancer patients become very thin. and suddenly become very thin because they take a lot of food. And so they become very tired, weight loss. And that is the reason cancer grows very fast, because they need all this food. Now, also the tumor can be affected, the insulin pathway. So it really make it harder for the body to use glucose effectively. So leading more insulin resistant, high blood sugar level. And that is common also. And because the inflammation of response, in other words, because your body is diabetic, right? So all the vessels are inflamed. And then the cancer come in, they also cause chronic inflammation, leading that your insulin sensitivity no longer sensitive, and worsen your hyperglycemic, because the insulin doesn't work, the blood sugar goes up. So hyperglycemia can be really higher. So that become a really multiple problem. That's why cancer, you don't want to be there. You want to make sure, take it off, go away. Even you're diabetic, stay with diabetes. Don't get another disease in. And that's what my key message today. Make sure that you want to make sure control, get rid of cancer, stay just diabetes, or from diabetes, type 2 diabetes, change it to pre-diabetic. Will help you tremendously. Good health is so important. 嗱，癌症咧對葡萄糖嘅用咧係好重要嘅，因為每一個癌症病人咧，佢係用咗好多葡萄糖，即係你個 blood sugar 去養佢自己嘅癌症嘅。所以你見到好多人咧，當佢係有癌症咧，忽然間好瘦，因為佢食咗好多你嘅營養劑啊，去高呢個癌症嘅佢個癌喺佢身體邊度生長咧，佢一定用好多糖咧去養佢自己嘅。咁所以變咗嚟講咧，呢個咧因為用咗好多糖咧，就令到你血糖咧就 whack， 即係高 whack 啦，即係上落啦。咁胰島素唔 work 嘅，因為用咗好糖啊嘛。咁而買胰島素咧，亦都佢個腫瘤咧破壞咗胰島嘅信息。咁你身體咧用好多嘅糖，但係因為咧用咗去邊度啊？去嗰個腫瘤嗰度啊。咁個胰島素咧就胰島素咧就繼續抗拒啦。咁同埋咧啲糖唔 work 啦，即係個胰島素唔 work 啦。咁個糖咧繼續上升。咁仲有啦，因為你全身係發緊炎噶嘛，因為你而家糖尿病已經全身發緊炎噶喎，嗰啲血管係脹晒㗎，放晒嚇。咁癌症咧亦都令到佢咧有慢性嘅發炎，咁導致你胰島素咧敏感度咧亦都下降，咁你血糖咪上升咯。咁所以變咗嚟講咧，最好咧就真係唔好有癌症，因為如果有癌症咧，就令到你真係多咗一樣嘢去控制咧，就好辛苦啦。嗱。So if you have actual cancer now, you after remove, unfortunately, a cancer, after usually the way how to do it is they will surgical remove. If they cannot, then they certainly start your chemotherapy. Majority of them, they will really see if you can have the surgical remove, make the cancer become smaller, then start treating you either by chemotherapy, target therapy, or radiation therapy. Or could be steroid therapy, hormone therapy, all these things will come in. But if you get chemotherapy, the chemotherapy drugs will actually harm your pancreas to make insulin. And that can cause your diabetes become worse, because you have no more insulin, a lot more insulin come out, then you lower insulin level, then your sugars are not being used, blood sugar goes up. Now, radiation is also can affect your insulin producing cell. So insulin sensitivity also become lessened. So the glucose doesn't get used up. And the radiation depends on where being used, zap, like for example, you have lung cancer, and area you're going to zap here will be also affect potential the pancreas. So these are the kind of things that you might be also concerned. Now, steroids, corticosteroid medicine, like hormone, can also have certain kind of side effect that affect your cancer treatment. And then it can also increase the blood sugar level. and make a heart insulin work properly. So all those are potentially affect your regular insulin function, and your blood sugar can be go high or go too low. And that's something that's common. 嗱，如果你有腫瘤嘅時候，大多數嘅醫生會話：，你可唔可以睇下割唔割到先？所有醫生都希望由大嘅腫瘤割細咗佢，做到好細好細或者唔見咗佢，咁咧就俾化療你啦，或者 immunotherapy 俾你啦，咁就能夠令到你胰島素咧但係呢啲咁嘅化療啊，或者你嘅 immunotherapy 啊，其他嘅 target therapy 啊，可能會影響你胰島素嘅生產。咁變咗嚟講咧，如果胰島素咧係降低咗，或者佢有個 resistance 咧，咁你嘅糖尿病惡化又好高咯喎，因為啲糖會繼續上升，冇胰島素上升噶嘛。咁仲有啦，如果你放射性治療即係 radiation 啦，如果放射治療咧，亦都影響胰島素個細胞嘅發展嘅，因為好多時你睇過你個胰島素你呢度係個肺癌嘅，咁你呢度係 pancreas 喺度附近嘅，咁照落去嘅時候咧，會影響你個胰臟嘅生產胰島素喎，咁變咗嚟講咧，咁你就可能唔夠胰島素用嘅喎。咁仲有啦，好多時喺類固醇嘅藥咧，或者係啲荷蒙藥啊，咁變咗嚟講，亦都會影響咧胰島素嘅運作。咁你個糖咧可以上升，或者變咗係唔夠胰島素用咧，咁你糖咧繼續上升嘅。咁所以變咗嚟講咧，你係要注重咧，你如果就割完症之後要做treatment， 你都知道你 treatment 會影響你胰島素同埋你嘅血糖嘅運作。Now, when you have diabetic, you now manage diabetes in cancer patient. So really, at the end of the day, as a diabetic patient, you add one more very critical treatment for yourself for cancer treatment. Is really a more stress and more complicated care to help you to make sure you can keep yourself, how to make you completely continue be healthy. Now, as you know, when you have cancer, you really have one cancer doctor working with you, which is the cancer doctor is called the oncologist. Now, you got to work with a diabetic doctor, which is endocrinologist. Then you got to make sure that you're going to have also work with a dietitian, because now your diet control for your diabetes, plus also with your doctors to talk about how to help you on your cancer treatment and dietitians. Plus, you might also, because you are so stressed, so depressed, you might have a mental health professional help you. So really become a very multidisciplinary team approach to help you to become a more healthier treatment process. So imagine that. That's why I said, don't go into cancer if you can. Stay with diabetes and get yourself into pre-diabetic is a better choice. But if you are, then you need to start looking at least this field profession to help you to continue to maintain healthy. Now, a lot of these treatments are usually individual. You really can't just say, wow, this is going to be one type of treatment, because the diabetic management could be different. The different cancer could be different. So each piece, and plus you have all the different cancer drugs, could be chemotherapy, could be immunotherapy, could be target therapy. Imagine all that become very crucial. So you really, at the end of the day, need to continue to be working with a multidisciplinary group, plus your treatment has to be all personalized to you. 各位同學，好重要，當你有癌症啦，咁變咗嚟講咧，你糖尿病癌症個 treatment 咧，一定係好複雜好多㗎。咁但係咧，你一定要有一個好嘅團體咧，係即係呢個醫療團體去幫你嘅。第一，你內分泌科啦，即係 endocrinologist 啦，你個腫瘤科啦，即係oncology 醫生啦，有營養師啦，就心臟病心理健康嘅護理員啦。因為你有糖尿病同埋癌症嘅時候咧，好多時咧你會有感覺死啦，會 depress 啦，咁可能真係要心理輔導嘅。 咁同埋呢啲 treatment 咧，全部要個人化嘅，就唔可以話啊一刀食晒，冇嘅，因為每一個人都唔同，因為你淨係 chemotherapy、immunotherapy、target therapy 呢啲全部都唔同咗啦。咁你 treatment 一定要即係要幫你係要個人化啦佢。But during this time, one of the very important, you have to have better blood sugar monitoring because all the treatment, including your chemotherapy or surgery even, will help to basically fluctuate your sugar up and down. So you really can't just say, wow, I'm going to stay put by all the things what I do before. No, it's going to be all different. So you really have very much so always measure blood sugar daily and up in the morning 4 times a day, so you can make sure that you are continue monitor. And if you are, I would highly suggest if you are a diabetic already, try to get one of the freestyle deliveries to continue measure your blood sugar, so you don't have to worry about, oh wow, I have to measure all my time, put myself, because you are so more engaged now. It's best to actually get something automated, easier for management. Now, you really have also have the nutritional guidance because you really have to figure, wow, I'm cancer now. I have to have better optimize my meal, stable blood sugar. Maybe I have to eat smaller portion and, more meal to be doing instead of eat one big meal all the time. So all that has to be planned, has to work out. So those are things that you have to consider. Plus, you have to have good communication with all the healthcare people, including your blood sugars, that you can talk to your endocrinologist, your issue with the cancer, oncologist, a dietitian. And plus, during the treatment, you have chemotherapy, all the different therapy, you're going to have effect in such a way which affect your blood sugar, affect your diet, everything. So you have to really mark down everything. Don't just say, okay, I will remember. I can assure you, you don't remember. You know why? I work with so many patients. So I told them that if you have cancer, you got to start tracking how your blood sugar is going every day, 4 times a day, measure, write it down. And all the problem you face, like for example, my wounds start bleeding. I have more pain here and there. I'm losing appetite. I wait every day. So you know what your progression has to write it down. When you are so sick and tired, if you don't write it down, you won't remember. When you go to a doctor, at least you have a sheet to tell them that, hey man, look, my sugars are okay, or my sugar up and down like rocket. And then what I'm eating, my weight is stable, or my weight is not stable. All that is documented. You have to tell the doctor so you can say, yeah, I better help you out with some of this stuff. If you don't document, you just talk to him, you might not know what is your problem, and he cannot help you. So all these things need to document and also write down what you have ate. Okay. Now I have a patient that actually has, cancer, and he diabetic. The problem this person is, earlier stage he write nothing down. So every day, Chinese that eat kanji. Kanji is the rice soup. And that's the worst thing for you, diabetic, because this thing is going to help you to absorb tremendously. The blood sugar is skyrocketing all the time. So we have to change the diet. Although she's thinking that, well, I'm sick, I got to eat kanji. Not necessarily. You can eat other stuff to give you the same nutritional status. So that way, at least when you write down the nutrition guidance by the dietitian, can give you a lot better guidance to give you the right type of diet, and also increase in nutrition, so your body have enough nutrition to fight. The person end up changing, not just drinking or not eating kanji anymore or the rice soup. They change to glucerna, which is a diabetic nutritional product. So when you get Nutricena, her blood sugars got much better and help her to gain energy to prevent every time the blood sugar is like skyrocketing. So that is the kind of things that you have to write down. I asked her earlier, she can't remember a thing. She just remember I ate a lot of crunchy. How much? Don't know. Everything when you have that kind of disease, you have to measure how much I ate, how much glucerna I ate. Easy is by can. So she can say, I make 220 milk. These are the kind of things that you gotta start doing. 嗱，因為你有呢個癌症嘅時候咧，你個腫瘤係食你好多糖嘅，因為咧佢係要你一定咧係營養係對佢自己嘅發展啊，腫瘤嘅發展啊。咁所以變咗嚟講咧，你血糖嘅監察咧係好重要嘅。如果唔係咧，你好多併發出嚟。嗱，仲有一樣嘢咧，你要係營養指導啦，同埋你要成日溝通啦，有咩痛狀啊，好重要。每樣寫低有個 sheet， 寫低我要食乜嘢啦，我要我血糖幾多啦，我磅數幾多啦，我有咩 activity 喺邊度痛啦，寫晒呢個 sheet。咁俾醫生睇嘅時候咧，佢就了解原來你嘅血糖都 OK 喎 ，stable 嚟。有一個真實個案啦，我哋有一個糖尿病病者啦，佢嘅 cancer 之後咧過晒啦。咁但係咧佢就係只係食粥，哇弊家伙啦！食粥嘅血糖係全部 skyrocket 嘅。我話見到咁高嘅時候，喂，點解你又知唔知食幾多啊？唔知，因為佢冇寫低。咁我俾個 sheet 佢咧寫低晒咧，咁佢就可能㗎。依家知我食咩，血糖幾多。咁最低限度咧，佢變咗咧就食glucerna 啦，就唔係食粥啦，營養好啦。咁同埋咧，佢營養師教到佢用好嘅東西啦，變咗咧佢個人咧亦都有營養，唔會食粥啦，好似奶奶咁食嘅人。OK， 咁呢個係一個好實現嘅現實嘅情況嘅。OK，now also。Exercise is important. Although you are diabetic and you have cancer, you have to move. You have to regularly exercise. And exercise actually improve your insulin sensitivity and overall being. And you got to talk to your doctor how much exercise you have. Usually walk is very good. So you need to start off a very good, safe exercise. Start walking with friends, even your cancer.Even you're diabetic, don't just sit there, don't do anything. Keep walking. Now, certainly, yes, it's going to be hard in the beginning. You're going to feel pain, especially after surgery. You feel weak, but do it because you don't want to just keep lying there. It's not going to help you. And you got to have psychological support because when you have cancer, you're diabetic, it's going to be a tremendous stress for you. That's why I said you don't want to be in cancer, you don't want to diabetic.So you want constantly to manage this two chronic disease because you have to continue to monitor. It won't go away. You really have to work on it. And it's good to get some group support, mindful practice, tools to help you out. As I said, one simple thing, write down everything from blood sugar, blood pressure, heart rate, and so forth.4 meals a day. What is your weight? Everything write down. When you have one whole week, write down. The doctor understand what you are. And they are very appreciative of the things you do, and they help you to be better, and you will able to recover faster. 嗱，運動係好重要嘅。嗱，我知道咧，大家割完症後或者要做 chemotherapy 好攰，唔想喐。其實糖尿病同埋癌症咧係要喐嘅，因為唔喐咧，你令到啲嗰胰島素唔得 sensitive 啊，咁變咗嚟講咧，越整越差，糖越整越高。咁喐係咩喐啊？好簡單，行啦，同埋你工人行又得，你同你親戚行又得，邊度行？但係最緊要喐，唔好淨係坐喺度，唔好淨係瞓喺度，越瞓就越差嘅。咁你出嚟咧，你同醫生傾下我做咩啊？可以做到咧，呢個係重要嘅。同埋心理嘅支持係好緊要嘅，因為咧，當你有癌症又有糖尿病咧，你一個人係好容易好快 depress 死啦，或點啊乜啦。咁所以變咗嚟講咧，最好咧就有多啲叫 support group 幫助你啦。咁同埋咧，亦都可以能夠喺工作上或者繼續去做工作嘅東西啦。咁能夠你有個支持力啦，呢個好重要嘅。咁當你有心理嘅輔導好啦，你運動好啦。 繼續係同啲朋友傾下偈啊，咁咧你個人嘅發展咧就一定好嘅。嗱，Lowsutea is so important. The reason why it does really support your blood sugar, cholesterol, and blood pressure. It does not affect your chemotherapy or immunotherapy or any of the drugs at no contraindication because it's only a food as only a guava leaf and bitter melon. So both have no contraindication in food or your medication. So basically, you can continue to drink your Lowsutea, and it's really good because you drink totally 8 cups of tea a day to help you to what? Get rid of the poison. It's a diuretic. It helps you to get rid of the fluid out continuously, get rid of the poison. It's so important. So believe me, drink more Lowsutea if you are doing treatment. It helps you. Now, certainly you have to go shishi a lot, go and pee a lot. That's okay. Get rid of the poison. And that is so important. And that result, it brings down of your blood sugar, cholesterol, and blood pressure. That will continue to help you. 嗱，飲虛糖茶咧係好重要嘅。嗱，其實虛糖茶咧係冇任何嘅東西咧令到啲糖會只係好，你膽固醇低、血壓低，亦都唔會 affect 你個即係化療啊，或者你 immunotherapy 啊、target therapy 係永遠唔 affect 到嘅。個原因就係裏邊其實得2樣嘢嘅啫，係 guava leaf 呢個番石榴葉同埋呢個苦瓜，唔係藥嚟嘅，所以變咗咧係冇任何嘅其對你嘅藥嘅反應係冇嘅。咁所以變咗，但係有好處咧，就係飲咗8杯茶咧，就幫你去排毒，繼續排毒晒啲嘢出嚟。咁呢個好重要，因為你排咗毒咧，咁你身體咧就更加健康。所以係好重要，你毒素係走咗出嚟先嘅，唔好放喺身體裏邊。So drinking Lowsutea, you control your blood sugar, cholesterol, and blood pressure. That will be tremendous helpful to you. Okay? So 飲咗虛糖茶一定降低你三高、血壓啦同埋膽固醇，所以呢個好重要嘅。嗱，咁今日嘅講座咧就完咗啦，但係好重要，記住呢幾樣嘢。Today we'll finish our discussion now, but very important, you have to remember, if you are able to early detection and build your awareness, what type of cancer you might have, if you can think about that and you link with that, you're diabetic, this is the cancer like colon, pancreatic, and my liver cancer, all that you link up, you're going to make sure that you right away, once you start seeing that, you get early intervention. In other words, you want to be early, talk to the doctor, start getting treatment right away. This is so important. Don't let it delay. Now, important, you have to address the patient. You have to have a whole total support. You have to manage yourself from the doctor, talk to the dietitian, talk to the oncologist, doctor, endocrinologist. All that will be part of your treatment together with the doctor as a team to give you all the advice on the type of treatment and better patient care for yourself so you have better quality of life. Now, as the sad part is you have already got diabetes, now you have cancer. Now, that means that now you have a continual lifelong disease to be controlled and monitored, and you have to start writing everything down and adopt this new life that you will have. And you have to continue work on it for your treatment. You cannot just forget. You have to have exercise, you have to continue monitor blood sugar, getting your treatment of cancer. All that will be part of a new thing for you, which you have to continue committed to work on. And now you have to spread around to tell people about, if you have cancer, and you now will give you the knowledge. You have to understand what is a cancer and diabetic, what's a link. And when you have cancer, why your sugar are being used up more because of the fact that cancer will ask for that sugar to support itself growth and eventually kill you, right? So you really need to basically know that. So you have to have good nutritional status So you have, just like you get more soldiers to fight the cancer. You don't let them to get you because you don't eat well, you start starving yourself. You can't do that. And all the patients who have cancer and diabetic, all the treatment might be really become very personalized, individual. The reason because many of the cancer treatments are all tailor-made, meaning that you might be potentially in chemotherapy, different type of therapy, target therapy, everything. So all those are very different. So that means that you really need to have a very, very different type of treatment for yourself, which you can make sure that you have able to handle it, even though you are, both diabetic and cancer together, to make sure that you have the right treatment to get your lifestyle to become better. It is complicated, but you have to continue to know and able to work on it together. But if you can't do that, you know what? You are going to be good living and continue to be healthy. And that's my objective today, to make sure that you are achieving that. OK？ 嗱，各位朋友，今日講咗好多嘢啦，但係好重要咧，你要知道啊，如果你有癌症嘅時候咧，你一定要咧有一個要知道咧，早啲係知道你癌症嘅，呢個好重要。即係你要知道，我要好早知道咧，我係有癌症喺我身體裏邊。一有知道之後咧，好重要咧，就要即刻咧去處理佢，唔係話可以 delay 啲啦，遲啲先啦。一有癌症就要同醫生講，我點能夠除咗呢個腫瘤？我嘅 next step 係割症啊，或者做 chemotherapy 啦，即係化療啦，或者 target therapy、immune therapy， 呢個要好快知道，要早決定，千祈唔好慢慢等喎，一等咧個癌一發出去擴散咧，你下難醫好多啦。癌症如果係第一期冇擴散，好正，好似我朋友，即係我有個女士咁，佢第一期割晒之後冇 chemotherapy， 繼續身體健康 ，very good， 佢只係繼續係 monitor 有冇其他癌症。但係呢個係重要嚟嘅，一定要繼續 monitor， 繼續睇住醫生。如果唔係咧，你第時再癌症都唔知㗎，有可能有㗎，係咪？所以一定要有早發現、早醫治、即刻醫，千祈唔好俾癌症發展到第二期、第三期咧，又再加你糖尿病咧，弊家伙咯！你個 treatment 係好 complicated，OK？ 咁啊唔正啦。咁其實咧，仲有一樣嘢咧，當你癌症嘅時候咧，會有令到你身體咧用咗好多你嘅糖咧去做醫佢癌症嘅細胞嘅，即係食咗你糖。咁你可能咧令到你糖咧 up and down 好慘，咁所以只要知道咧你個糖每日點樣你寫低晒佢，生活係點樣，食乜嘢寫低晒佢，你糖係高 up and down 都寫晒佢，令到俾醫生睇咧，就令到佢知道原來 OK 喎，或者你 manage OK 唔 OK 喎，食咩又唔 OK 啊？好似唔好話哇，我唔好掂啊食粥啦，死啦！糖越整越高，因為粥係好多糖嘅。咁食咩啊？好似 glucose 飲個亞培嘅營養劑啦，最喺度我啲糖唔會高，但係有營養，有營養我先有機會打呢個cancer。OK， 咁仲係咧就希望今日聽個嘢咧，能夠你知道癌同埋呢個糖尿病嘅發展係點樣。咁你有一個防禦性嘅東西，同埋每一個樣嘢去做咧，都要係好 personalize 嘅，因為咧癌症咧就係因為係要好 personalize 嘅 treatment 嚟嘅。唔係話個個都係咁樣嘅，因為你可能有 chemotherapy 啦、化療啦、immunotherapy 啦、target therapy 啊，不同嘅 therapy、radiation 乜都有，所以呢個係一個好 complicated treatment。OK， 咁嗱，各位今日講咗咁多啦，咁希望咧就可以能夠令到咧大家有咩問題啦，如果有問題咧，你寫信俾我哋啊，就 Andy ANDY at wahfong.com WAHFONG.com ANDY at WAHFONG.com. WhatsApp me 852-3001-5644. WhatsApp 我哋 ，OK？So you can ask question. Very happy to help you and answer a question. And I know today we're a little longer, but I think it's so important to able to get this for everybody who can able to associate, the cancer and also diabetes. I think this lecture will hopefully help many people who are diabetic. And now suddenly they realize, wow, I have a high chance to get certain type of cancer. Now I have to watch. And hopefully today, because you now alert, understand, so you can able to really become more aware. And so you can prevent, even you can early detection of cancer. That is the key. The success is early detection and early eradication. Get rid of it. Either cut off, chemotherapy, whatever, get rid of it. Then you'll be continually healthy and live long to see your grandchildren and all your family, and you'll be happy. So today's lecture, I hope that will help you to better understand. You, as I said, if you have a question, write to me, Andy, ANDY at WAHFONG.com, or WhatsApp me 852-3001-5644. So hope that this lecture can help you to build this awareness, and that's my whole objective. And thank you very much. I hope, is there any question I could add, you want to ask, I could also answer now. If not, I wish you, first of all, a happy Merry Christmas and a healthy New Year. Now, on the December 30th, there will be no lecture because it's too close to New Year. I know everybody want to go to celebrate himself. It's okay. Next lecture will be January 6th on Saturday, and Hawaii time is January 5th. Hawaii time, January 5th will be your next lecture, and Hong Kong is January 6th, okay? And we'll have more and more exciting lectures. I don't think anybody will talk about all the lectures that now we discussed. I got so many comments come from all different places. They said, wow, your lecture is good, because most of the people just talk about eat, but not talk about disease process. You mean there's so many deep things that is associated with pre-diabetic, diabetes, and all the disease that go with it. So a lot of people don't know that. And I hope that I build this awareness so you can now understand and able to work on it and able to understand and link this together and talk to your doctor fast and then alert them and then able to get a treatment early. Don't think the doctor will know everything of you. A lot of time, all the symptom has to come from you. Like, for example, one of my patients had bloody urine. And he asked, what is this? I said, oh, bloody urine is not necessarily just come from anywhere. You have to really quickly talk to the doctor. So that actually, they act and all that. So really, at the end of the day, doctor will not know you have bloody urine. The worst thing is one of my patients said, oh, doctor will know. I said, doctor don't know. You have to tell them, then they will know. They cannot guess what happened to you. So these are the kind of basic things that, don't worry, the doctor would love to hear from you. Don't feel embarrassed to talk to the doctor. Go talk to them, because that is your doctor and they want to help you. So do that, please. 各位朋友，嗱，記住3月30號咧，我哋冇講座嘅。For Hawaii 朋友咧，就10月29號都冇講座，因為就係年假啦。下一次講座咧係1月6號同埋1月5號 Hawaii time 美國 time 1月5號啦。咁希望大家再見面啦。咁我恭祝你身體健康，新年快樂，同埋聖誕快樂，同埋身體更加健康好緊要。同埋仲有一樣嘢，繼續咧去 monitor 自己，話俾醫生聽有咩唔妥，千祈就唔好話哇唔敢唔想話俾醫生啦，我驚喎，唔好話咗睇醫生有咩講先。OK， Merry Christmas and Happy New Year, and thank you for attending this webinar. I appreciate. Really good to see you. Take care, my friend. Happy New Year. And IG people, can you give me a like or give me a Facebook people? Can you give me a like so we know you are listening? and just give me a like. That would be wonderful. And thank you again for attending, and appreciate all the following, and wish you Merry Christmas and Happy New Year. Thank you very much, folks. Take care. Bye-bye.